NCLEX questions with answers and rationales. Real Exam Practice 2026. Question 1. A nurse is placing an intravenous line for a patient with active tuberculosis and human immunodeficiency virus. Which safety equipment is required? Option A. Sterile gloves and mask. Option B. Surgical cap and gloves. Option C. Double gloves and gown. Option D. Goggles and mask and gloves and gown. The correct answer is option D, goggles and mask and gloves and gown. Universal and airborne precautions require full protective equipment to prevent the transmission of both bloodborne and respiratory pathogens. Question 2. The Good Samaritan laws are enacted to: Option A. Protect hospitals from lawsuits. Option B. Provide immunity from liability to those who provide emergency care at an accident scene. Option C. Ensure patients sign advance directives. Option D. Enforce nursing home reform. The correct answer is option B, provide immunity from liability to those who provide emergency care at an accident scene. These laws encourage people to help in emergencies by protecting them from legal liability as long as they act reasonably. Question 3. A client with a chest drainage system in place should have the system positioned where? Option A. Above the client's head. Option B. At the client's shoulder level. Option C. At the level of the chest. Option D. Below the level of the chest. The correct answer is option D, below the level of the chest. Chest drainage systems must be kept lower than the client's chest to allow gravity to help the fluid and air drain out. Question 4. What is the primary role of an incident report in a hospital setting? Option A. To discipline staff for errors. Option B. To provide data to prevent future problems and avoid risk. Option C. To protect the hospital from all liability. Option D. To replace the nursing care plan. The correct answer is option B, to provide data to prevent future problems and avoid risk. Incident reports are a risk management tool used to analyze trends and improve safety protocols. Question 5. A nurse needs to give an intramuscular injection to an infant. Which site is the preferred choice? Option A. Ventrogluteal. Option B. Deltoid. Option C. Vastus lateralis. Option D. Dorsogluteal. The correct answer is option C, vastus lateralis. The vastus lateralis in the thigh is the most developed muscle in an infant and the safest site for an injection. Question 6. A client taking the antibiotic ciprofloxacin develops severe muscle and tendon pain. What is the most likely cause? Option A. Electrolyte imbalance. Option B. Impending tendon rupture. Option C. Calcium deposits. Option D. Antibiotic-associated colitis. The correct answer is option B, impending tendon rupture. Fluoroquinolone antibiotics like ciprofloxacin have been linked to a risk of Achilles tendon rupture. Question 7. A nurse is assessing a 4-week-old baby with colic and a stressed mother. What technique should the nurse teach? Option A. Distraction with a red object. Option B. Prone positioning. Option C. Tapping reflex techniques. Option D. Neutral warmth techniques. The correct answer is option D, neutral warmth techniques. Neutral warmth such as swaddling can help soothe an agitated infant and reduce symptoms of colic. Question 8. Which of the following is a live virus vaccine? Option A. Varicella. Option B. Inactivated polio vaccine. Option C. Diphtheria and pertussis. Option D. Hepatitis B. The correct answer is option A, varicella. Varicella and the oral polio vaccine are examples of live virus vaccines. Question 9. Which of the following is the most appropriate medication to relieve severe chest pain during a stress test? Option A. Aspirin. Option B. Diazoxide. Option C. Nifedipine. Option D. Mannitol. The correct answer is option C. Nifedipine. Nifedipine provides rapid relief of ischemic chest pain by dilating coronary arteries. Question 10. A nurse is assessing a patient with a coronary artery bypass graft and notes a mole with irregular edges. What is the priority? Option A. Remove the mole with a scalpel. Option B. Note the location and contact the attending physician. Option C. Note the location in the record and do nothing. Option D. Tell the patient to see a dermatologist after discharge. The correct answer is option B. Note the location and contact the attending physician. Any mole with irregular edges and unusual color may be melanoma and should be reported to the attending physician for follow-up. Question 11. A nurse is screening for vaccine contraindications. Which of the following is not a contraindication? Option A. Seizures. Option B. A fever for more than 3 days. Option C. A malignancy. Option D. The chronic illness lasting more than 6 months. The correct answer is option D. A chronic illness lasting more than 6 months. While acute illness and fever are contraindications, a stable chronic illness is generally not a reason to withhold vaccination. Question 12. A nurse at an outpatient clinic receives several calls. Which call is the highest priority? Option A. The patient with heel skin breakdown. Option B. The patient with a new cast who cannot feel their fingers. Option C. A patient who thinks they sprained their ankle 2 weeks ago. Option D. The patient with normal pain after a knee replacement. The correct answer is option B. A patient with a new cast who cannot feel their fingers. Neurovascular changes in a cast extremity are an emergency and require immediate medical intervention. Question 13. A 60-year-old widower is hospitalized with shortness of breath and a sense of impending doom. What is the best nursing response? Option A. You have nothing to worry about and are safe. Option B. Has anything happened recently that might have triggered these feelings? Option C. I will give you medicine for anxiety. Option D. Try to take deep breaths and calm down. The correct answer is option B. Has anything happened recently that might have triggered these feelings? Asking about triggers encourages the client to discuss their feelings and helps the nurse understand the cause of the anxiety. Question 14. Which of the following is the final sensation in the progression of cold application? Option A. Cold. Option B. Burning. Option C. Aching. Option D. Numbness. The correct answer is option D. Numbness. The stages of cold application follow the cold then burning then aching then numbness sequence known as the cold burn ache numb mnemonic. Question 15. A nurse is assessing an 18-year-old with a head injury and notes a slow pulse and impaired respiration. What is the likely cause? Option A. Increased intracranial pressure. Option B. Meningitis. Option C. Sympathetic nervous system response. Option D. Normal recovery. The correct answer is option A. Increased intracranial pressure. The combination of a slow pulse and irregular respirations along with hypertension is known as Cushing's triad and indicates high intracranial pressure. Question 16. A sinner cells in the pancreas are responsible for which type of secretion? Option A. Endocrine. Option B. Exocrine. Option C. Plasma. Option D. Beta. The correct answer is option B. Exocrine. A sinner's cells produce exocrine secretions, which are the digestive enzymes used in the small intestine. Question 17. A nurse is caring for an acutely psychotic patient. Which intervention is inappropriate? Option A. Conveying calmness. Option B. Recognizing your own feelings. Option C. Encouraging the client to participate in group therapy. Option D. Listening to identify the causes of behavior. The correct answer is option C. Encouraging the client to participate in group therapy. Acutely psychotic patients can be disruptive and overwhelmed in groups, so one-on-one interaction is preferred until they are stable. Question 18. In which plane of movement does shoulder flexion occur? Option A. Horizontal. Option B. Sagittal. Option C. Frontal. Option D. Vertical. The correct answer is option B. Sagittal. The sagittal plane divides the body into left and right and is the plane where flexion and extension movements happen. Question 19. A patient has had a heart catheterization and wants to walk 3 hours later. What should the nurse do? Option A. Tell the patient to stay with the leg straight for at least another hour. Option B. Will allow the patient to walk with assistance. Option C. Call for a physical therapy consult. Option D. Tell the patient they must wait another 6 hours. The correct answer is option A. Tell the patient to stay with the leg straight for at least another hour. Patients must typically keep the affected leg straight for at least 4 to 6 hours after a femoral artery catheterization to prevent bleeding. Question 20. Which part of the brain is responsible for the regulation of sleep-wake cycles and can cause disruptions if injured? Option A, thalamus. Option B, cortex. Option C, medulla. Option D, hypothalamus. The correct answer is option D, hypothalamus. The hypothalamus is the primary center for regulating circadian rhythms and sleep patterns. Question 21. A nurse finds a client unresponsive. What is the standard ratio of compressions to breaths for two-person adult cardiopulmonary resuscitation? Option A, 5 to 1. Option B, 15 to 2. Option C, 30 to 2. Option D, 3 to 1. The correct answer is option C, 30 to 2. Current guidelines recommend 30 compressions followed by 2 rescue breaths for adult cardiopulmonary resuscitation. Question 22. Which medication is an antihyperglycemic used for type 2 diabetes that does not stimulate insulin secretion? Option A, glyburide. Option B, metformin. Option C, glipizide. Option D, insulin. The correct answer is option B, metformin. Metformin works by reducing glucose production in the liver and improving insulin sensitivity in the body. Question 23. A patient on the medication Floxin must be monitored for which rare and serious adverse effect? Option A, stunting of growth. Option B, tendon rupture. Option C, intractable diarrhea. Option D, excessive bleeding. The correct answer is option B, tendon rupture. Quinolone antibiotics like Floxin have a black box warning for the potential of Achilles tendon rupture. Question 24. A nurse is checking the therapeutic lithium level for a client. Which value is considered toxic? Option A, 0.8 milliequivalents per liter. Option B, 1.0 milliequivalents per liter. Option C, 1.2 milliequivalents per liter. Option D, 1.5 milliequivalents per liter. The correct answer is option D, 1.5 milliequivalents per liter. Lithium levels above 1.5 milliequivalents per liter are generally considered toxic. Question 25. A nurse is instructing a patient on the order of sensations for an ice bath. What is the correct sequence? Option A, cold and aching and burning and numbness. Option B, burning and aching and cold and numbness. Option C, cold and burning and aching and numbness. Option D, numbness and aching and cold and burning. The correct answer is option C, cold and burning and aching and numbness. The cold burn ache numb progression is the standard physiological response to cold therapy. Question 26. Which of the following medications is a neuromuscular blocker used during surgery? Option A, pitressin. Option B, Pavulan. Option C, insulin. Option D, furosemide. The correct answer is option B, Pavulan. Pavulan is a muscle relaxant used to facilitate intubation and provide muscle relaxation during surgical procedures. Question 27. Which of the following is a task-centered supervisory responsibility? Option A, coaching a staff member. Option B, evaluating performance. Option C, setting team targets. Option D, rewarding a staff member. The correct answer is option C, setting team targets. Target setting is task-focused while coaching and rewarding are people-centered supervisory activities. Question 28. Which of the following is a symptom of increased intracranial pressure? Option A, tachycardia. Option B, bilateral pupil constriction. Option C, change in level of consciousness. Option D, polyuria. The correct answer is option C, change in level of consciousness. An altered level of consciousness is one of the most sensitive and earliest signs of rising intracranial pressure. Question 29. A patient is diagnosed with diabetes mellitus. Which of the following is not a common clinical sign? Option A, excessive hunger. Option B, excessive urination. Option C, metabolic acidosis. Option D, lower extremity edema. The correct answer is option D, lower extremity edema. Edema is not a primary sign of diabetes, while polyphagia and polyuria and acidosis are classic manifestations. Question 30. A nurse is reviewing an electrocardiogram report and notes a flat T wave and depressed ST segment. Which medication can cause this? Option A, morphine. Option B, atropine. Option C, nifedipine. Option D, digitalis. The correct answer is option D, digitalis. Digitalis has characteristic effects on the electrocardiogram, including ST segment depression and T wave changes. Question 31. The Moro reflex in a newborn involves which physical movements? Option A, grasping an object tightly. Option B, turning the head toward a touch on the cheek. Option C, opening hands and extending extremities after a jar. Option D, curling the toes downward. The correct answer is option C, opening hands and extending extremities after a jar. The Moro reflex is the startle response where the infant extends the arms and legs, then pulls them back in. Question 32. What is the primary purpose of an incident report in a healthcare facility? Option A, to prove negligence in a court of law. Option B, to punish employees for mistakes. Option C, to provide data for analysis to avoid future problems. Option D, to communicate with the client's family. The correct answer is option C, to provide data for analysis to avoid future problems. Incident reports are risk management tools used for quality improvement and to identify system failures. Question 33. Which direction given to a nursing assistant is most effective for a stat lab specimen? Option A, take this to the lab when you can. Option B, please deliver this as soon as you finish your break. Option C, the client is sick and we are worried. Option D, take this specimen to the lab immediately and hand it to a technician. The correct answer is option D. Take this specimen to the lab immediately and hand it to a technician. Clear and specific and urgent instructions are necessary for high-priority tasks. Question 34. A client with a chest drainage system should have the device placed where? Option A, at the level of the bed. Option B, on the bedside table. Option C, on the floor or below the level of the chest. Option D, attached to the head of the bed. The correct answer is option C, on the floor or below the level of the chest. The system must be kept below the level of the chest at all times to ensure that gravity facilitates drainage and prevents backflow. Question 35. A nurse walking in the hallway overhears a confidential change of shift report. What is the priority action? Option A, tell the family members in the hallway to move. Option B, report the nurses to the Board of Nursing. Option C, inform the charge nurse so the situation can be corrected for privacy. Option D, ignore it because it is not your unit. The correct answer is option C. Inform the charge nurse so the situation can be corrected for privacy. The nurse has an ethical duty to protect client confidentiality by notifying the charge nurse of the privacy breach. Question 36. A nurse identifies a child with behavioral characteristics of attention deficit disorder. Which behavior is consistent with this? Option A, slow speech development. Option B, overreaction to stimuli. Option C, inability to carry on a conversation. Option D, concrete thinking. The correct answer is option B, overreaction to stimuli. Children with attention deficit disorder often have an exaggerated response to environmental stimuli and are easily distracted. Question 37. A client and family facing the end stage of a terminal illness would be best served by which service? Option A, a rehabilitation center. Option B, an extended care facility. Option C, hospice. Option D, a crisis intervention center. The correct answer is option C, hospice. Hospice provides specialized interdisciplinary care focused on comfort and quality of life for terminal patients. Question 38. A nurse suspects an elderly client has been abused but the client denies it. What is the next action? Option A, do nothing because the client refused. Option B, report the incident to the police immediately. Option C, arrange a meeting with the next of kin. Option D, educate the client about available support services. The correct answer is option D. Educate the client about available support services. The nurse should remain non-judgmental and provide information about community resources and safe options for the client. Question 39. Which of the following vaccines is a live attenuated virus? Option A, varicella. Option B, inactivated polio. Option C, diphtheria and tetanus. Option D, a hepatitis B. The correct answer is option A, varicella. Varicella is a live virus vaccine while the others listed are inactivated or subunit vaccines. Question 40. Spirituality is best defined as option A, a belief in an organized religion. Option B, an individual's relationship with a higher power. Option C, a belief in scientific principles. Option D, a mandatory weekly worship service. The correct answer is option B, an individual's relationship with a higher power. Spirituality is a personal relationship or belief in a higher power or infinite source of energy. Question 41. A client has sustained an acute hyphema from a blunt injury. What would the nurse observe? Option A, a red eye with no visible pupil. Option B, a half-moon appearance of blood in the anterior chamber. Option C, a blue tint to the white of the eye. Option D, total loss of the eye globe. The correct answer is option B, a half-moon appearance of blood in the anterior chamber. A hyphema is the collection of blood in the front of the eye usually caused by trauma. Question 42. A nursing advocate is best described as one who, option A, makes all decisions for the client. Option B, encourages clients to make their own decisions and supports those choices. Option C, manages the legal finances of the client. Option D, acts as the client's primary physician. The correct answer is option B, encourages clients to make their own decisions and supports those choices. Advocacy involves supporting the client's right to autonomy and self-determination in their healthcare decisions. Question 43. A nurse is teaching a community class about accidental poisoning. What should be the first action taught? Option A, give the child milk to dilute the poison. Option B, induce vomiting with syrup of ipecac. Option C, contact the poison control center immediately. Option D, rush the child to the nearest clinic. The correct answer is option C, contact the poison control center immediately. Poison control centers offer the most accurate and immediate advice for specific poisonings. Question 44. Metformin is a medication commonly used for type 2 diabetes. Which statement is true? Option A, it is an insulin analog. Option B, it is a hypoglycemic agent. Option C, it is an anti-hyperglycemic agent. Option D, it is a pancreatic stimulant. The correct answer is option C, it is an anti-hyperglycemic agent. Metformin prevents high blood sugar without typically causing the dangerous lows associated with other diabetic drugs. Question 45. The nurse sustains a needle puncture from an infected client. Which medication regimen is usually started? Option A, a broad-spectrum antibiotic. Option B, a 2 non-nucleoside reverse transcriptase inhibitors. Option C, a single dose of a protease inhibitor. Option D, a corticosteroid and an antiviral. The correct answer is option B, 2 non-nucleoside reverse transcriptase inhibitors. 2 non-nucleoside reverse transcriptase inhibitors are the standard choice for human immunodeficiency virus post-exposure prophylaxis. Question 46. A nurse identifies an infant with a Moro reflex. This is characterized by option A, grasping a finger placed in the palm. Option B, turning the head toward a touch on the cheek. Option C, extending extremities after a jarring motion. Option D, stepping movements when held upright. The correct answer is option C, extending extremities after a jarring motion. The Moro reflex is a normal startle response in infants where they extend and then retract their limbs. Question 47. Which of the following is an exocrine secretion produced by acinar cells in the pancreas? Option A, insulin. Option B, glucagon. Option C, digestive enzymes. Option D, somatostatin. The correct answer is option C, digestive enzymes. Exocrine secretions like digestive enzymes are released into the small intestine, while insulin and glucagon are endocrine hormones. Question 48. A nurse is assessing a 55-year-old man after a left frontal lobe stroke. Which change is most likely? Option A, loss of vision. Option B, loss of hearing. Option C, alterations in behavior and emotion. Option D, inability to taste food. The correct answer is option C, alterations in behavior and emotion. The frontal lobe of the brain controls personality and social behavior and emotional expression. Question 49. A nurse finds a client unresponsive on the floor. What should the nurse do first after determining unresponsiveness? Option A, check the pulse. Option B, open the airway. Option C, call for help. Option D, begin chest compressions. The correct answer is option C, call for help. Activating the emergency response system or calling for help is always the first priority after determining unresponsiveness. Question 50. A patient has been prescribed nifedipine for severe chest pain. This medication acts by option A, slowing the heart rate. Option B, dilating coronary arteries to increase oxygen. Option C, thinning the blood. Option D, reducing blood sugar. The correct answer is option B, dilating coronary arteries to increase oxygen. Nifedipine is a calcium channel blocker that dilates blood vessels to improve blood flow to the heart muscle. Question 51. Which of the following findings would indicate a need for immediate intervention in a client with increased intracranial pressure? Option A, pupils that are equal and reactive. Option B, a respiratory rate of 18. Option C, a systolic blood pressure of 120. Option D, a Glasgow Coma Scale score that decreases from 14 to 10. The correct answer is option D, a Glasgow Coma Scale score that decreases from 14 to 10. A drop in the Glasgow Coma Scale score indicates a significant decline in neurological status. Question 52. Administering hypotonic intravenous fluids is the standard of care for a patient with increased intracranial pressure. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option B, false. False. Hypotonic fluids can cause brain cells to swell and worsen the intracranial pressure. Question 53. Which of the following lab values is indicative of symptomatic acquired immunodeficiency syndrome? Option A, KT4 cell count greater than 1000. Option B, KT4 cell count less than 500. Option C, KT4 cell count greater than 2000. Option D, KT4 cell count less than 200. The correct answer is option D, AT4 cell count less than 200. AT4 cell count below 200 per deciliter is the clinical definition for a diagnosis of symptomatic acquired immunodeficiency syndrome. Question 54. A nurse is assessing distance vision using a Snellen chart. If the result is 20/30, what does it mean? Option A. The client can read at 20 feet what a normal eye reads at 30 feet. Option B. The client can read at 30 feet what a normal eye reads at 20 feet. Option C. The client has perfect vision. Option D. The client can only see with the left eye. The correct answer is option A. The client can read at 20 feet what a normal eye reads at 30 feet. The top number is the distance from the chart and the bottom number is the distance at which a person with normal vision could read that line. Question 55. A nurse identifies a patient with a slow pulse and impaired respiration after a head injury. This indicates option A, normal sleep patterns. Option B, increased intracranial pressure. Option C, improved neurological status. Option D, a sympathetic nervous system response. The correct answer is option B, increased intracranial pressure. Slowing of the heart rate and irregular breathing are late signs of dangerously high intracranial pressure. Question 56. A sinner's cells in the pancreas are responsible for producing endocrine secretions like insulin. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option B, false. False. A sinner's cells produce exocrine digestive enzymes while the islets of Langerhans produce endocrine hormones. Question 57. Which of the following medications is a muscle relaxant used for acute muscle pain? Option A, mivacron. Option B, atropine. Option C, bethanacol. Option D, aflexaril. The correct answer is option D, flexaril. Flexaril is a commonly used medication to treat spasms and pain in the muscles. Question 58. A nurse sustains a needle puncture. What drug class is typically used for prophylaxis? Option A, antibiotics. Option B, antifungals. Option C, protease inhibitors. Option D, anticoagulants. The correct answer is option C, protease inhibitors. Protease inhibitors are a primary part of the drug cocktail used to prevent infection after exposure to human immunodeficiency virus. Question 59. Which of the following sensations is not a part of the progression during an ice water bath? Option A, cold. Option B, burning. Option C, aching. Option D, tingling. The correct answer is option D, tingling. The progression of cold therapy is cold, then burning, then aching, and finally numbness. Question 60. The drop factor for a microdrop intravenous set is always 60 drops per milliliter. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Microdrop sets are used for very precise and slow delivery of fluids or medications. Question 61. Which of the following is a symptom of cellulitis in an extremity? Option A, cold skin. Option B, red and swollen and warm skin. Option C, blue skin. Option D, itchy skin with no swelling. The correct answer is option B, red and swollen and warm skin. Cellulitis is a bacterial skin infection that causes localized heat and redness and swelling. Question 62. A nurse finds a client unresponsive. What is the correct ratio of compressions to ventilations for adult cardiopulmonary resuscitation? Option A, 5:1. Option B, 15:2. Option C, 30:2. Option D, 3:1. The correct answer is option C, 30:2. Current standards for healthcare providers involve 30 compressions followed by 2 breaths. Question 63. A clinical pathway for congestive heart failure includes which of the following? Option A, medication education. Option B, a nutritional consult. Option C, follow-up appointments. Option D, all of the above. The correct answer is option D, all of the above. Clinical pathways cover all essential aspects of care and education required for a patient before they are discharged. Question 64. A nurse discovers a mole with irregular edges and bluish color on a patient. This finding is most suggestive of option A, a normal birthmark. Option B, melanoma. Option C, a harmless cyst. Option D, a fungal infection. The correct answer is option B, melanoma. Irregular edges and unusual colors in a mole are primary indicators of potential skin cancer or melanoma. Question 65. Which of the following is not a contraindication for an immunization? Option A, a high fever. Option B, a recent malignancy. Option C, a chronic illness lasting more than 6 months. Option D, a severe allergic reaction to a previous dose. The correct answer is option C, a chronic illness lasting more than 6 months. Stable chronic illnesses are generally not a reason to skip scheduled vaccinations. Question 66. Which of the following is the most critical and earliest indicator of a change in neurological status? Option A, short-term memory. Option B, level of consciousness. Option C, Babinski sign. Option D, Clonus sign. The correct answer is option B, level of consciousness. Any change in the level of consciousness is the most sensitive indicator that a patient's brain function is being compromised. Question 67. A nurse identifies an infant with the Moro reflex. What jarring motion usually triggers it? Option A, clapping the hands. Option B, a dropping the head slightly. Option C, loud noises. Option D, all of the above. The correct answer is option D, all of the above. The Moro reflex is a startle response that can be triggered by a sudden loud noise or the feeling of falling. Question 68. Which of the following is a task-centered supervisory responsibility? Option A, coaching a new nurse. Option B, delegating tasks. Option C, facilitating a meeting. Option D, rewarding performance. The correct answer is option B, delegating tasks. Delegation is a task-centered activity while the other options focus on the development of personnel. Question 69. Which medication is the primary choice to treat symptomatic bradycardia? Option A, Caestran. Option B, Digitalis. Option C, nitroglycerin. Option D, atropine. The correct answer is option D, atropine. Atropine is used to increase the heart rate by blocking the action of the vagus nerve on the heart. Question 70. A nurse suspects a patient has Bell's palsy. To test cranial nerve 7, the nurse should: Option A, check the gag reflex. Option B, check taste on the front of the tongue and facial muscle movement. Option C, check vision and eye movement. Option D, check the hearing in both ears. The correct answer is option B, check taste on the front of the tongue and facial muscle movement. The facial nerve is responsible for the muscles of facial expression and taste on the anterior 2/3 of the tongue. Question 71. A client with tuberculosis can be taken off restrictions after negative culture results are obtained. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Negative sputum cultures confirm that the client is no longer harboring the infectious bacteria in a communicable form. Question 72. A nurse finds a client bleeding from an arterial blood gas site. What should be done first? Option A, document the bleeding. Option B, call the physician. Option C, apply firm pressure to the site. Option D, check the blood pressure. The correct answer is option C, apply firm pressure to the site. Immediate pressure is required to stop the bleeding and prevent a hematoma from forming at an arterial site. Question 73. The Good Samaritan laws are intended to protect healthcare providers from liability during emergency care at an accident scene. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. These laws provide legal protection to those who offer reasonable help in an emergency. Question 74. A nurse sees a client sitting alone and talking to voices. What is the most therapeutic nursing action? Option A, touch the client to bring them to reality. Option B, leave the client alone. Option C, ask the client to describe what is happening. Option D, tell the client there are no voices. The correct answer is option C, ask the client to describe what is happening. Asking about the voices acknowledges the client's experience while providing the nurse with important assessment information. Question 75. The purpose of the Patient Self-Determination Act of 1990 is to encourage individuals to make decisions about their care before they need it. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. This act requires healthcare facilities to inform patients of their right to make healthcare decisions and have advance directives. Question 76. What is the primary organ responsible for the metabolism of most drugs? Option A, the kidneys. Option B, the liver. Option C, the stomach. Option D, the lungs. The correct answer is option B, the liver. While the kidneys excrete many drugs, the liver is where the chemical breakdown or metabolism occurs. Question 77. A nurse identifies a patient with a slow pulse and irregular breathing after a head injury. This is known as Option A, Cushing's triad. Option B, Beck triad. Option C, Horner's syndrome. Option D. Wernicke encephalopathy. The correct answer is option A. Cushing's triad. Cushing's triad is a clinical sign of increased intracranial pressure and is a medical emergency. Question 78. Which of the following is an exocrine secretion produced by the pancreas? Option A. Insulin. Option B. Glucagon. Option C. Digestive enzymes. Option D. Somatostatin. The correct answer is option C. Digestive enzymes. Digestive enzymes are exocrine secretions because they are released into a duct that leads to the small intestine. Question 79. What is the standard ratio of compressions to ventilations for one-person adult cardiopulmonary resuscitation? Option A. 15 to 2. Option B. 30 to 2. Option C. 5 to 1. Option D. 3 to 1. The correct answer is option B. 30 to 2. The current guidelines for a single rescuer are 30 compressions for every 2 rescue breaths. Question 80. A nurse suspects an elderly client is being financially abused. What is a common sign? Option A. They have plenty of money. Option B. They are short on cash since a relative moved in. Option C. They have new clothes. Option D. They attend all their doctor appointments. The correct answer is option B. They are short on cash since a relative moved in. Financial exploitation often involves a relative taking control of a senior's funds, leaving them unable to pay for needs. Question 81. Which part of the brain is most likely injured if a patient shows significant changes in behavior and emotion? Option A. Occipital lobe. Option B. Parietal lobe. Option C. Frontal lobe. Option D. Temporal lobe. The correct answer is option C. Frontal lobe. The frontal lobe is the center for personality and emotional regulation and social behavior. Question 82. Which medication is an anti-hyperglycemic used for type 2 diabetes that does not cause the pancreas to release more insulin? Option A. Glyburide. Option B. Metformin. Option C. Glipizide. Option D. Insulin. The correct answer is option B. Metformin. Metformin works by reducing the amount of sugar produced by the liver and making the body more sensitive to its own insulin. Question 83. A nurse is teaching a community class on poisoning. What should be the first step if a child swallows a toxic substance? Option A. Make them drink milk. Option B. Induce vomiting. Option C. Call the Poison Control Center. Option D. Give them activated charcoal. The correct answer is option C. Call the Poison Control Center. The Poison Control Center can provide specific instructions based on the substance ingested, which is the safest first step. Question 84. Which of the following sensations is the third stage in the progression of cold application? Option A. Burning. Option B. Aching. Option C. Numbness. Option D. Cold. The correct answer is option B. Aching. The progression is cold, then burning, then aching, then finally numbness. Question 85. Which medication can cause a flat T wave and depressed ST segment on an electrocardiogram? Option A. Morphine. Option B. Atropine. Option C. Nifedipine. Option D. Digitalis. The correct answer is option D. Digitalis. These specific electrocardiogram changes are classic indicators of digitalis effect or toxicity. Question 86. The final stage of cryotherapy is numbness, which indicates the application has been effective in providing localized anesthesia. Option A. True. Option B. False. Option C. Not applicable. Option D. Not applicable. The correct answer is option A. True. True. Once the area is numb, the cold has significantly slowed the nerve conduction for pain. Question 87. What is the preferred site for an intramuscular injection in an infant? Option A. Deltoid. Option B. Ventrogluteal. Option C. Vastus lateralis. Option D. Dorsogluteal. The correct answer is option C. Vastus lateralis. The vastus lateralis is the largest and most developed muscle in an infant and is the safest site for an injection. Question 88. A nurse discovers a mole with irregular edges and a bluish color on a patient who just had heart surgery. What is the priority? Option A. Remove it immediately. Option B. Note the location and contact the physician. Option C. Tell the patient to see a dermatologist next month. Option D. Do nothing as it is probably a bruise. The correct answer is option B. Note the location and contact the physician. Irregular moles must be evaluated for melanoma and the attending physician should be notified so a consult can be ordered. Question 89. Which medication is used for the rapid relief of severe chest pain caused by ischemia? Option A. Aspirin. Option B. Diazoxide. Option C. Nifedipine. Option D. Mannitol. The correct answer is option C. Nifedipine. Nifedipine, also known as Procardia, is often used to quickly manage severe angina. Question 90. A nurse identifies an infant with a Moro reflex, which is a normal startle response. Option A. True. Option B. False. Option C. Not applicable. Option D. Not applicable. The correct answer is option A. True. True. The Moro reflex is an expected developmental finding in newborns and typically disappears by 4 to 6 months. Question 91. What is the standard therapeutic range for a patient taking lithium? Option A. 0.1 to 0.5 milliequivalents per liter. Option B. 0.6 to 1.2 milliequivalents per liter. Option C. 1.5 to 2.0 milliequivalents per liter. Option D. 2.0 to 3.0 milliequivalents per liter. The correct answer is option B, 0.6 to 1.2 milliequivalents per liter. This narrow therapeutic window requires frequent blood monitoring to avoid dangerous toxicity. Question 92. A nurse is assessing a 55-year-old man after a left frontal lobe stroke. Which change is most typical? Option A. Loss of sight. Option B. Loss of hearing. Option C. Alterations in personality and behavior. Option D. Inability to taste. The correct answer is option C, alterations in personality and behavior. The frontal lobe is heavily involved in social behavior and personality, making these the most likely areas of change. Question 93. Eosinate cells in the pancreas produce exocrine secretions while the islets of Langerhans produce endocrine secretions. Option A. True. Option B. False. Option C. Not applicable. Option D. Not applicable. The correct answer is option A. True. True. The pancreas has both exocrine digestive functions and endocrine hormonal functions. Question 94. What is the drop factor for a microdrop intravenous set? Option A. 10 drops per milliliter. Option B. 15 drops per milliliter. Option C. 20 drops per milliliter. Option D. 60 drops per milliliter. The correct answer is option D. 60 drops per milliliter. Microdrop sets are standardized at 60 drops per milliliter for precise medication delivery. Question 95. Which medication is the drug of choice for treating symptomatic bradycardia? Option A. Caestran. Option B. Digitalis. Option C. Nitroglycerin. Option D. Atropine. The correct answer is option D. Atropine. Atropine is the primary treatment for slow heart rates that cause symptoms like dizziness or low blood pressure. Question 96. A nurse finds a client unresponsive and activates the emergency response system. What is the next step in cardiopulmonary resuscitation? Option A. Check for a pulse. Option B. Give 2 rescue breaths. Option C. Start chest compressions. Option D. Open the airway. The correct answer is option C. Start chest compressions. Current adult resuscitation guidelines prioritize chest compressions immediately after calling for help. Question 97. Which of the following is an exocrine secretion of the pancreas? Option A. Insulin. Option B. Glucagon. Option C. Amylase. Option D. Somatostatin. The correct answer is option C. Amylase. Amylase and lipase are digestive enzymes produced in the exocrine portion of the pancreas. Question 98. What should the nurse do first when a client is found bleeding from an arterial blood gas site? Option A, call the physician. Option B, apply pressure to the site. Option C, check the vitals. Option D, document the event. The correct answer is option B, apply pressure to the site. Firm and direct pressure is the immediate priority to stop arterial bleeding and prevent hematoma. Question 99. Which of the following is a symptom of increased intracranial pressure? Option A, tachycardia. Option B, bilateral pupil constriction. Option C, change in level of consciousness. Option D, polyuria. The correct answer is option C, change in level of consciousness. Changes in level of consciousness are among the earliest and most sensitive indicators of rising intracranial pressure. Question 100. A nurse identifies a patient with a slow pulse and irregular breathing after a head injury. This indicates Cushing's triad and is an emergency. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Cushing's triad is a classic sign that the brain is under dangerous pressure. Question 101. Which of the following is not a common clinical sign of diabetes mellitus? Option A, excessive hunger. Option B, excessive urination. Option C, metabolic acidosis. Option D, lower extremity edema. The correct answer is option D, lower extremity edema. Edema is not a primary symptom of diabetes, while polyphagia and polyuria and acidosis are. Question 102. What is the preferred site for an intramuscular injection in an infant? Option A, deltoid. Option B, dorsogluteal. Option C, vastus lateralis. Option D, ventrogluteal. The correct answer is option C, vastus lateralis. The vastus lateralis in the lateral thigh is the safest and most developed site for infants. Question 103. A nurse discovers a mole with irregular edges and unusual color. This finding is suggestive of melanoma. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Any mole that changes in shape or color should be evaluated for skin cancer. Question 104. Which of the following medications can provide quick relief for ischemic chest pain? Option A, aspirin. Option B, diazoxide. Option C, nifedipine. Option D, mannitol. The correct answer is option C, nifedipine. Nifedipine works as a vasodilator to quickly improve blood flow and oxygen to the heart. Question 105. The Moro reflex is a normal startle response in infants that includes extending the extremities. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. This reflex is expected in newborns and its absence can indicate neurological problems. Question 106. Which of the following medications is a muscle relaxant? Option A, mivacron. Option B, atropine. Option C, bethanacol. Option D, flexeril. The correct answer is option D, flexeril. Flexeril is commonly used to treat muscle spasms and related pain. Question 107. Eosinate cells produce exocrine digestive enzymes in the pancreas. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. These cells are responsible for the non-hormonal digestive functions of the pancreas. Question 108. What is the standard ratio of compressions to ventilations for adult cardiopulmonary resuscitation with one rescuer? Option A of 15:2. Option B 30:2. Option C 5:1. Option D 3:1. The correct answer is option B, 30 to 2. The current standard for healthcare providers is 30 compressions for every 2 rescue breaths.